Hey mama, so many women are preparing for birth but don't know what to expect after birth and are caught a little off guard about what goes on. But the more you understand about what's to come, the more confident you will be as a new mama. So in this video, I'm talking about 2 questions I've been frequently asked by you about birthing the placenta and the after pains that begin after baby is born. I'm Bridget and I'm a childbirth educator and a birth doula, and it's my passion to help mamas believe in the reality that they are built to birth. If you're new to this community of empowered mamas, make sure you subscribe and hit the little bell so you don't miss out on any future empowering and informative videos about pregnancy, birth, and postpartum. Now, it would seem fair that after giving birth, everything should go back to normal right away and that you wouldn't have to worry about the afterbirth stuff. But a part of a woman's incredibly designed body, certain things do happen to keep mama healthy and safe that are actually pretty incredible, but can be a little unexpected if you don't know about them beforehand. By the end of this video, you are going to understand what giving birth to the placenta is like, some complications that can possibly arise, and afterbirth pains, what they are and what they feel like, and how to manage them. Knowing these answers to these questions will help you feel prepared and confident to embrace postpartum as soon as it begins. So for those of you who don't already know, the placenta is an organ that your body grew in the first trimester to support and nourish your growing baby. The placenta is just another aspect pointing to how amazing the female body is. Not only are you growing a small human from the moment that the sperm meets the egg, but you grow an entirely separate organ to help that tiny human live and thrive in their first home, the womb. It wasn't there before you got pregnant, it won't stay in your body after you're pregnant, and you'll regrow a brand new one each time you get pregnant. It's seriously so fascinating. But because your body makes this organ specifically for each pregnancy, it must dispose of it at the end of the pregnancy. There is a shelf life, if you will, on a placenta, and as you and your baby near the end of 40 weeks of that pregnancy, that placenta begins aging. After baby is born and they have received all the blood that they can from their placenta through their umbilical cord, and then that cord is clamped and then cut, they are now being fully sustained by you, mama. And just really quick, since we're talking about cord clamping and cutting, you should really check out this video that I've linked up here about delayed cord clamping and the many benefits of doing it after the birth of your baby. So once baby is born, the next thing that needs to come out is the placenta. And this point of the labor is called the third stage of labor. And if you're new to hearing about the term stages of labor, you have so much more you can look forward to learning about to become more confident and empowered. And I recommend checking out my Built to Birth online class, which teaches you about what birth is all about, how to be empowered through it, and how to be most informed about it. The course builds up your mind, your body, and your team for your birth experience so that you can have a happier, healthier, and easier birth. So if you want to access that kind of education and empowerment, you can follow the website link builttobirth.com, which is linked in the description below. Now, the placenta is typically born between 5 to 30 minutes after the birth of baby. At the end of birth, your body is gushing with oxytocin, which is the love hormone that makes labor work. And it's one of the many hormones at work during and after birth that, again, you learn all about in my Built to Birth online course. But you can also get a quick rundown about those hormones in this video that I've linked up here. This oxytocin keeps your surges, also called contractions, to keep going, although they are typically milder than those in labor. And what this will do is cause the placenta to detach from the wall of the uterus where it's been throughout pregnancy. A lot of times there will be a small gush of blood when the placenta detaches, which usually is what tips your care provider off that the placenta is ready to come out. Sometimes mama will feel a little bit of pressure from the placenta resting on her cervix and will want to give a little push to push it out, and other times the OB or midwife will tell mama to give a little push in order to expel the placenta. Now, most of the time, the birth of the placenta is not a big deal at all, especially after giving birth to a baby. Most of the time, the hardest part is the 1 or 2 pushes that mama has to give to help the placenta to come out, because by that point she has used up so much of her energy to birth her baby, and those couple pushes are challenging. Thankfully, birthing the placenta is not typically painful. In my opinion, the most uncomfortable part of birthing the placenta was feeling the umbilical cord on my labia, because it's already so sensitive after birth, and it was just kind of like a cold, wet noodle, and it was just uncomfortable. But the actual birthing of the placenta was so much easier than birthing my baby, and it wasn't even something that I thought about as soon as it was over. Now, sometimes complications can arise with the placenta that make the 3rd stage of labor a little bit more challenging. Sometimes the placenta doesn't come out on its own, and this is called a retained placenta. So if the placenta doesn't detach and come out on its own within about 30 minutes, this is considered a retained placenta, and your care provider will need to step in with an intervention to help it be born. Because the body no longer needs the placenta after baby is born, the placenta starts to deteriorate, and if it's left in the body, it poses the risk of infection, which can be life-threatening for mama. Plus, after birth, the uterus needs to shrink down to its pre-pregnancy size, and it can't do that until the placenta is gone. So if it's left in there, it can cause severe blood loss. But your care team is staying very active and attentive during this 3rd stage of labor to make sure that your body is doing everything it should naturally and ready to step in if it doesn't. Sometimes it will be encouraged to get baby on the breast to help release more oxytocin to help the placenta to detach. Pitocin might even be given to mama to help expel the placenta. A doctor might try to manually detach the placenta by gently tugging on the cord or getting it out by using their hands, or in a more life-threatening but also very rare situation, may call for an operation to remove the placenta surgically. But like I said, that's very rare, and thankfully our bodies are generally, most of the time, very capable to do it all on their own. Now, for any mamas who have given birth before, comment down below your experience of birthing the placenta so we can get some different opinions out there for mamas to read. Now let's talk about contractions after giving birth, because most mamas don't think about these until they're happening and you wonder if it's normal. Just like the uterus continues to contract after baby is born to help expel the placenta, the contractions continue to help the uterus shrink down to its pre-pregnancy size. These contractions are known as afterpains and can last up to 7 to 10 days after birth. Now, they don't happen consistently all the time as they did in labor, and they gradually decrease in intensity, but they need to happen in order for your body to heal properly. You'll notice more of these afterpains while you're nursing or cuddling your baby, and the reason for that is that the hormone that we mentioned, oxytocin. Oxytocin is released in high quantities during breastfeeding and when you're feeling loved, such as while you're cuddling your newborn or even your partner or loved one. This surge of oxytocin helps squeeze that uterus to help it continue healing and shrinking down. This is also why you'll notice a gush of blood when you stand up after nursing your baby during that initial postpartum week, because that oxytocin is making your uterus contract. I talk all about postpartum bleeding in this video linked up here that you for sure should check out after this one. Now, typically, the more times you've had babies, the more intense you feel the afterpains. So for your first baby, it's just sort of feels crampy, like you're PMSing. And then for your second baby, it feels more distinct and uncomfortable. Then for your third, they may feel even more intense to where you may even have to breathe through them like you did for your labor surges. These sensations are not bad or mean something is wrong, but there are things you can do to help manage them so that you are more comfortable. One thing that you can do is rub lavender, peppermint, and clary sage essential oils onto your belly using a carrier oil. And this helps so much with afterpains and is also great for when you have your first postpartum period again and experience those uncomfortable, sometimes very painful PMS cramps. To make this little mixture, you'll take a teaspoon teaspoon of fractionated coconut oil or vitamin E oil. Add 1 drop of lavender, 2 drops of peppermint, and 1 drop of clary sage. And then you'll rub it onto your abdomen before you begin nursing. This is one of my favorite blends, and the scent to me is so calming as well. And I'll link all of these products down below for you to get for yourself. One thing you do want to be careful of when using this on your belly is that you want to make sure that you wash your hands super well before picking up baby, especially because of that peppermint oil, which can really irritate their eyes if they get it in there accidentally or even their sensitive skin. So wash your hands and then try to avoid laying them skin to skin on your lower belly and abdomen where you're going to be rubbing that mixture for about an hour after applying it on that belly and abdomen. The second thing you can do for those after pains is using warmth on your belly, such as a heating pad, a DIY rice sock that you can microwave, or a warm water bottle. I'll link down below an electric heating pad and a microwavable warm pack. You can also try After Ease, which is a tincture that you drink to help ease those contractions after birth. All of the ingredients in that tincture are natural and organic, and this product is especially helpful for mamas whose second, third, or fourth baby this is, and it's linked down below for you to get. And then last but not least is Afterbirth Ease Tea, which is great for any mama no matter what number birth they are on, and really helps soothe and reduce the discomfort after giving birth so you can enjoy the time with your newborn more and not have to worry about those not so fun contractions. Those are all natural methods you can use, and I believe the more natural products that we put into and onto our body, the better, but sometimes we do need more powerful things, especially if you feel like you are suffering, because that's definitely not something anyone wants you to experience. So typically, ibuprofen will help alleviate the discomfort if nothing else works. So, mamas, I hope you learned a thing or two about what to expect after the birth of your baby. I hope that you are trusting in the fact that your body is literally built to birth your baby and then heal after the birth of your baby in a really incredible way. I hope you are feeling more empowered after learning what you have learned from this video and one step closer to experiencing a confident postpartum period. So, thank you for being with me in this video, and I will see you in the next one. Bye, mamas.